Hey folks, Dr. Hartl here. Today we're going to talk about newborn babies. First of all, congratulations. You are about to embark on one of the most difficult but most rewarding challenges that we face as humans. That being said, don't worry about it too much. It's pretty hard to screw it up badly. Uh, Everyone does it vastly differently around the world, and most of the kids turn out just fine. As long as you love your child, feed your child, and take care of yourself so that you set a good example for your child, your kid is probably going to be fine at the end of the day. You're going to make mistakes. We all make mistakes. Your parents made mistakes. My parents made mistakes. I make mistakes in raising my own children. But don't worry about it too much. Learn to roll with it and make course corrections as you go along. So the first thing we have to talk about is breastfeeding. I could fill a whole half-hour video just about breastfeeding, but we're not going to cover all the minutiae here. If you have more questions, you can see the links that are provided with the video. We are obsessed with breastfeeding these days, and for good reason. If you can continue to breastfeed your child until they are at least 4 months old, but preferably 6 months old, then it decreases infections by about 60%. It is a huge benefit. That means less diarrhea, less cough and congestion, less ear infections, overall less infections in your child. That's the main benefit that we care about, but there are other minor benefits as well. That being said, the dirty little secret about breastfeeding is that the first week is very, very hard. Breast milk isn't made until the baby starts to feed at the nipple. That then sends signals to the brain saying, hey, we need to start making some breast milk, and then the brain sends signals back down to the breast saying, hey, make breast milk. Unfortunately, that cycle takes at least 2 to 4 days. So most moms don't have breast milk until about the 3rd or 4th day after starting breastfeeding. So while you were pregnant, your breasts were making a substance called colostrum that's very protein and nutrient dense that's designed to carry your baby until your breast milk comes in. Sometimes it doesn't do a great job, and generally into night 2 and 3 can be fairly stressful for a lot of parents. The most important thing I can tell you in breastfeeding is keep going. When you get stressed out, keep going. It will get better, I promise. The most important aspect of breastfeeding is the latch, so how your baby is latched onto your breast. The goal is to have your baby's mouth as wide open as possible and your nipple as far back in their throat as possible. Sometimes it can be a little painful when you're first latching your baby on, but it shouldn't be painful while you're breastfeeding. If it's painful while you're breastfeeding, then there's probably something wrong, and you usually want to take them off and re-latch them. If you'd like to see a video about the proper latch and kind of what the visual picture looks like, you can see the links that are provided with the video. There are a few nutrients that breast milk does not have. So the first that we talk about in newborns is vitamin D. So vitamin D is used to regulate calcium and to build bones in newborns. And you can put mothers, breastfeeding mothers, on huge doses of vitamin D, and it still doesn't cross into the breast milk very well. And we don't entirely understand why, but most major medical organizations these days recommend supplementing newborns with a little bit of vitamin D, especially breastfed newborns. So you can talk to your provider about which supplement they usually recommend, but there's a lot of over-the-counter ones. So D-Visol is the classic one, and it's usually 400 international units per 1 milliliter, and you're going to give your infant 1 milliliter every day. If you're breastfeeding, you can squirt it right in their mouth. If you're pumping and bottle feeding, you can put it right into the bottle, just once a day. The other nutrient that we talk about is iron. So breast milk has almost no iron in it at all. And for your newborn, that's not much of a concern. So your newborn stole a bunch of iron from mom before they came out. And so they stored it in their liver, and they're good to go for at least 6 months. However, it is important to start solid foods at 6 months to make sure that your infant has enough iron. So the most important aspect of your child's sleep is where they sleep and in what position they sleep. So we recommend that all newborns sleep on a firm mattress, likely in a crib or in a bassinet, and on their back, not on their stomach. And the reason for those recommendations is because that is the lowest risk scenario for preventing a disease called SIDS. SIDS stands for Sudden Infant Death Syndrome, and it's basically where the parents wake up and the child is gone. A couple hundred kids die of SIDS every year in the United States. We don't know exactly what causes SIDS, but we know that that is the lowest risk position for babies. We don't recommend that you share your bed with your infant. A lot of parents want to sleep in the same bed. That is an increased risk of SIDS, so we don't recommend that. Babies are pretty amazing when they sleep. They generally cycle down to the lowest level of sleep within about 30 seconds, whereas it takes an adult 5 or 10 minutes. So it's pretty cool. That being said, what's not so cool is your infant is not going to be sleeping through the night until at least 3 or 4 months. So don't try to sleep train them. Don't let them cry it out. Don't do anything like that. Just respond to your infant when they're crying and try to assess why they're crying or just comfort them. But at this age, we generally don't recommend crying it out. So a couple of safety things. The first is that your infant should be in a rear-facing car seat that's appropriate for your infant. That is the safest position for them. And the newer recommendations are saying that your child should be rear-facing until they are even older than 2. So they're going to be that way for a little while. We recommend no sun exposure until your child is at least 6 months. You can take them outside. Probably want to wait for a couple of weeks here, but you can take them outside, but don't put them in direct sun until they're at least 6 months old. And then make sure your house has functioning smoke and carbon monoxide detectors. So a fever is considered an emergency in your child until they're at least 2 months old. And the reason for that is sometimes the fever is just the tip of the iceberg. Your child can be very, very ill and only showing a little bit of fever, and we want to know about that because we take that very seriously. If you suspect your child might have a fever, the best way to check is with a rectal thermometer, and anything more than 100.4 degrees Fahrenheit or 38 degrees Celsius is considered a fever, and you should see your provider immediately.